First, I want to thank BFI and our entire team. It takes a village to do a research project, and we have lots of collaborators within the university and in the communities, and I especially want to thank the students that really did the bulk of the work on this study. And so we're going to do a little do-si-do. I'm going to start, and then Laura's going to take over, and then I'm going to wrap it up, and then we'll open up for questions. So just a little background, I'm sure that you're all aware that we have this public health crisis. There's been increasing consumption of sugar-sweetened beverages that we abbreviate as SSBs, not just soda, but a lot of other sugar-sweetened beverages, some that are called healthy beverages or energy drinks. So there's a wide variety of sugar-sweetened beverages, and these are leading to increased chronic diseases, child obesity, type 2 diabetes, tooth decay, and other diseases. So to try to combat that, Berkeley actually became the first city in the country to pass a sugar-sweetened beverage tax, which we called Measure D, and it was a huge advocacy across diverse communities here. A lot of young people were involved in that as well. It's great to see the young people here today. And this then required 1 cent per ounce tax on the beverage and to be paid by the distributor, but studies that were done subsequently found that the distributor then passed on this cost to consumers as well. The proceeds went to the general city fund with a promise that it would go to schools and health promotion measures, and then the city commission of experts was appointed to decide where the funds would go, and 1.2 million were collected in the first year, and they fulfilled their promise to give the funds to these schools and health promotion measures. So we have a couple research questions. Actually, there are many research studies that are being done on the soda tax, not only in Berkeley, but all over now, that they've been passed also in Albany, Oakland, and San Francisco. Our study is looking at 2 issues. What was the public debate in the media around the soda tax, and what did parents of young children think about sugar-sweetened beverages and the tax? And we're trying to learn some lessons that then can be applied to future advocacy around this issue. So I'll hand over to Laura to talk about the media.
Thank you. And as Karen mentioned, I'm Laura Nixon from Berkeley Media Studies Group, and we wanted to look at how did the debates about the soda taxes play out both in social media, in the campaign materials that were sent, and also in the news. And we looked at both Berkeley and San Francisco. And so I'll just run through a couple of our key findings from that. The first is that, and I should mention that we had also done similar analyses of previous soda taxes that were proposed in Richmond, in El Monte, and in Telluride prior to the Berkeley tax. And so what we found in these particular debates around Berkeley and San Francisco is that there was a much bigger emphasis on when folks were talking about the tax, they were calling out the soda industry. In the past, that had been present, but it hadn't really been a dominant argument. And when we talked to people within the campaign, one of the things they said was, well, we kind of knew this was going to be an argument, but what really changed it, but we didn't really think that this was going to be like the argument that we were focusing on. But then we realized that that was what people really responded to. Like our base, our supporters were really fired up about this because they could see, particularly here in Berkeley, just all of the billboards plastered everywhere. The BART station is plastered with all this stuff. People were upset, and so this was something that really inspired people to get out and talk to their neighbors and all that. And so this ended up being a big part of the debate. We also found that in comparison to some of the previous debates about soda taxes, there was a much greater variety of voices present in the media. So, for example, in Richmond and El Monte, it was really 1 or 2 elected officials who were really sort of carrying the message, a city council member, a mayor who was really the person who was sort of the figurehead and the person who was really the representative of the soda tax initiative. Whereas in Berkeley and San Francisco, there was much greater diversity in terms of health professionals, people in public health, elected officials, community members, all of those different kinds of things that we would hope to see. And so it made it for a much stronger, I think, representation in the media. We also found that there was quite a big difference in terms of the anti-tax arguments. So in Berkeley, some of you may remember, there was a big emphasis on loopholes. It was sort of this idea that like the tax wasn't healthy enough. It didn't go far enough. I think they must have done some focus groups or something and figured out Berkeley, they really care about health. We're gonna say it's not healthy enough. Whereas in San Francisco, it was all about cost of living and affordability. The other thing that we looked at was oral health, because we know that that's a huge impact of sugary drinks, but it's not often talked about. And sure enough, we found that there were absolutely no oral health professionals who spoke in the news about the soda tax, and oral health was only mentioned in 2% of articles about the soda tax, compared with, I think, around 40% for obesity and diabetes. Finally, after the election happened and Berkeley won, the Berkeley soda tax won in a landslide, there was a lot of debate about whether Berkeley was going to set a precedent. And the soda companies were saying, oh, Berkeley was just low-hanging fruit. These are people who give medicinal pot to, homeless people, and these are just, this is definitely, and the rest is history. We can see that, in fact, it did set a precedent, and we're seeing a lot of momentum, and so that's very exciting.
Thank you. Okay, so I'll talk about our discussions with the parents. We did focus groups and interviews with parents, and these are some of the themes. First, I want to say overall, as a public health professional, I see a big balance between factors pushing towards health and pushing away from health. And in general, it's really hard to eliminate unhealthy things, but we want to tip the scales to make the healthier choices, the easier choices, and the most affordable choices. So what we found from our discussions with the parents is that there were many factors that were pushing towards increased soda and sugary beverage consumption in their families and the communities. They always talked about the children were attracted to sweet drinks because of the sweet taste, and they discussed a lot the addictive properties of sugary beverages. And sitting in the focus groups, what I heard was an echo of the discussion around tobacco. And I think, again, as we look at this issue, we really need to learn a lot of lessons about the success in the advocacy against tobacco. There's so many similar themes. And so we have to, again, call out some of the harms that are actually similar about tobacco and also use some of the strategies. They also said that they try to be good at home and limit their children's consumption of sugary beverages, but when they're out in social settings, at parties and even at soccer games and all, there seems to be a cultural norm to serve soda in larger and larger quantities. And they also said as parents, they try to be strict, but then there are enablers, the friends and aunts and uncles and grandparents that try to win the favor of their children by giving them sweets and sugary drinks. So that's been an issue for them. Also, the widespread advertising, the availability, and the low cost of these drinks make them really easy to buy, especially for children who have a little money to go down to the store and buy them. In terms of decreasing SSB consumption, many parents discuss their personal experience with health problems as a result of their own overconsumption of sugary drinks. Many people had diabetes, and virtually everybody in the Latino community that we interviewed and talked to in the focus groups, they either had diabetes or they had relatives and friends with diabetes. So this was a big issue, as well as tooth decay. Parents who perceived it was their responsibility to make the rules at home and limit sugary drinks, they seemed to be more successful in doing that. And those who had had nutrition education felt that they were stronger in their resolve to limit these beverages. Also, they found that restrictive policies like no soda in the school was very helpful for them, and Measure D in adding the tax. And the other thing we did is we showed some of these anti-sugar-sweetened beverage health education posters to parents and asked what they thought about them. And just take a look at some of them and maybe think about your own reactions to them. But what we heard from the parents is that negative and scary images can make people feel stigmatized and powerless to make changes. And they felt that actually positive images could be more effective. They also said that too many words and statistics on the posters were overwhelming, and they felt that they could connect more to simple images and stories. And they also said, just as Laura had found in the media analysis, that tooth decay really wasn't addressed, and they could really relate to the problem of mouth pain and expensive dental bills, and that would be a helpful new issue to help promote these taxes. So in summary, some of the implications that we heard from our discussions with parents was that policy and laws could really be promoted to make water universally available, especially in schools and the community, and to limit ads availability and affordability of sugar-sweetened beverages, to make the healthy choice the easiest choice, especially for children. And also to explicitly designate the tax funds for children's health education and nutrition programs. In the community, they wanted to be sure we restrict sugar-sweetened beverages in public settings, schools, hospitals, athletic events, and provide nutrition education for adults and children. And finally, encourage teachers, doctors, and dentists to talk with families about restricting sugar-sweetened beverages and use media for positive health messaging. So thank you, and we welcome any questions and comments.
Thank you for that. I live in Seattle, where this is currently up for debate, and it's interesting to note that you didn't have any discussions about this being a regressive tax. That's a full-blown argument right now in Seattle. So I'm wondering if you could speak to if you think that's just place or if it's part of the message or something else that prevented that from coming up in this discussion.
Sure, yeah, and it really wasn't very present in Berkeley, whereas we did see it in San Francisco. They did call out to some extent sort of the regressivity, and there were some statistics about, I forget, how many millions were going to be paid by folks who made under $20,000 and things like that. But we did see it much more in Oakland. And one of their, and I haven't really been following in Seattle, but one of their big, kind of their new thing was calling it a grocery tax and talking about that. And it's absolutely an issue. My sense is that they have all the money in the world to throw at this, so they go in and do very good focus group testing and whatever folks. I'm sorry? Oh, sorry, it's the soda industry. Yes, and particularly the American Beverage Association, which is the trade association that all this money is funneled through. They do research in all these cities, and they look at what's resonating most with the residents in that particular city, and then they tailor their arguments based on that.
I thought it was great that you identified that the 1.2 million that you have to work with, and then in your focus groups, they're asking for positive messages. And to put those two together is such an exciting challenge, because it's true, all the posters you put up there were kind of scary images. For me, that meant, that might move me to action, but you really want the fact that you got this, fairly strong message that no, we're going to be motivated by, bright, healthy teeth, savings in dental bills, and that kind of thing is such, it's so wonderful. You know what to do, and you have the resources to do it. So that's exciting. Just a comment.
I had a question. So I love your guys' parent perspective, because I think it's very fascinating to look at people who do really care about their kids and how to best set them up for later in life. But I was wondering, of course, if you guys looked into a little bit about the kids' perspective, if there are alternative drinks that these campaigns are focusing towards, because personally, if I can't have a Coke, I'll have an apple juice. But wait, apple juice has more sugar than Coke sometimes. So I was wondering if you guys could speak to, especially because I noticed in the brochure it says kids below 12 years old. Are there any alternatives that you guys support? Are there any alternatives that the media is trying to push into besides water that can kind of talk to the kids a little bit more than just it's bad for your teeth? Because I know a lot of times that's a hard message to get to a 10-year-old kid.
Yeah. Thank you for asking that question. That's really great. We were looking at parents of young children, but it's really important to talk with teenagers, and especially children who have access to their own money will spend it on the things that they choose. So I think this would be an excellent study for all of you young people to engage in. Very important. Of course, water is the healthiest beverage that we have, and we would encourage everybody to drink water, but I think this would be a really important study for you to do. So thank you. Hopefully, Berkeley Food Institute might fund that. Yeah. Thank you so much. Thank you. And Laura, sorry. Sorry. One more quick question.
So if this is a regressive tax and it affects people who are in lower income communities who maybe have less access to education and to public health campaigns, or less access to dietary and nutritional information, how does this kind of program go about targeting those kinds of audiences in a more effective and cohesive manner than things that already exist, right? So like, how do we create awareness or programs for individuals who are, in lower income areas who don't have the same access to information? How does this tax necessarily solve for those kinds of problems?
Did you want to talk about that?
Sure. Well, one thing so for example, in Oakland, this was definitely a concern in terms of, we know that the places where there's most consumption of this are the low-income areas. And so one way that they are addressing that is that they created a community advisory board, rather than in Berkeley we have a panel of experts, I believe it's called, and community members. But in Oakland they wanted to make sure that it was really focused on community, and so there's a requirement that there's representation from the low-income areas of Oakland, and so they're trying to do that. And I think, as was just mentioned, one of the beautiful things about a tax is that it provides the money to then be able to do that targeting, to do that education. And I'll put it out there that right now there's currently a debate going on in Oakland because they're looking at the budget for the next year, and the mayor has proposed taking the money from the soda tax and putting it into the general fund. And so we're trying to mobilize and make sure that that doesn't happen, and that the Oakland city leaders, put that money towards the health programs. And so if anyone's interested, definitely keep an eye on that.
Great, thank you.